Okay, team, we've got Dr. Sheetal on the podcast today. Hello.
Hello, Gavin.
And what we thought we'd talk about today was chronic pain and tension, okay? Because a lot of our members at Growing Younger for a start have lots of pain, and I know obviously yours do as well, doing what you do. So I'll just let Sheetal introduce herself and tell her what business she runs, what she does, and then we'll jump into some questions.
Thank you. Yeah, so I'm a chiropractor. I own Functional Health, which is right across the road from Growing Younger's Howick branch. And I'm also a yoga instructor, so background and understanding the body, pain, and emotional side of things, flexibility, movement side of things, and the mechanics. Yeah.
Easy peasy. Good stuff. Okay. So I think the first thing we'll start with is there's two questions I want to ask. Number one, what is chronic pain and what is tension? Because a lot of people don't know the difference. Okay. So start with chronic pain. What is it?
That's actually a really good question. And yeah, it's true. Most people don't realize the difference. Can I go into a little background story?
Go.
Yeah. So in the past, we've had little kids that came along and they would say, this is sore or something. But I would be like, is it sore or is it tight? And eventually I was able to teach people, not even kids, adults as well. This is tension, this is tight, this is sore. So chronic pain is pain that has been there for longer than 6 months. And typically if people have come in with pain for more than 2 years, more than 10 years even, and they've just lived with it because they think it is normal. So that's what chronic pain is, when you've got pain, discomfort. Tension, on the other hand, doesn't always necessarily require pain. There could be stiff, it could be feeling tight, could be feeling restricted, but it doesn't have pain.
Sure. Okay. So I'll check another question in there. So a lot of people don't understand, I guess, different services. So at Growing Younger, we have a physio. Okay. So what do you do differently to physio as well? Because I'll give you some context to this whole thing.
Yeah. So I don't want to speak on behalf too much, but what I've learned about is that with physio, we do a lot more rehabilitation. And chiropractor, it's about the alignment of the structures in the body. So starting off with the spine as a primary place where we know the brain is the boss of the body, and it will send signals through the nervous system, through the nerves, and the nervous system is actually encased by the spine. And as we move around and things get stuck a bit, that can impact the posture, which will then impact the muscles that attach to the spine, and also impact the body's ability to even heal because of the signals that the nerves are sending to those muscles or the injury spaces. So allowing the body to be in a more aligned space, and also the nervous system to be flowing in a better way.
Easy. Okay, cool. So when we obviously chatted about what we're going to talk about today, one of the big things that we have is back pain, right? So I'm going to need particular questions around back pain, but just tell us what you experience with the chronic pain side of things. So the things like sciatica, the discs, all those sorts of things.
Yeah. So what we tend to have people come in with is all types of chronic pain. This could include frozen shoulder, stuck shoulders, can be neck, can be hips and knee. A lot of people have knee discomfort, can be low back, upper back, and even sciatica. Some people don't realize that sometimes the sciatica that they're feeling is actually coming from their buttocks or the low back. And they typically think it's two different things, but maybe they no longer have pain in the low back, but because the body's learned to deal with it. But if we go and feel it, and when they come in for the consultation, they'll realize how stuck it is in that area because those muscles have actually impinged on that area and created nerve pain down the leg.
Sure. So it's more like a referred pain, isn't it? So
yes.
I guess if you see some people with like an achy behind the knee, but it's actually an issue up in the glute, let's say, or lower back. Is that what you're saying?
Yeah. So let me actually explain that furthermore. That's a good question then. When it comes to the knee, sometimes, well, first of all, what I look at is the knee movements, alignment as well. But what we have found a lot is that there'll be a lot of pain or a misalignment that comes from the center of the body first. And as that misaligns, then the other parts of the body begins to then compensate for it. So we might find pelvis or low back not aligned properly, nerve function not going there properly, and that will then impact the knees and the muscles that attach to the knee joint, which will then impact the ankle as well. So it's actually a whole chain effect.
For sure, it is a kinetic chain, isn't it?
Exactly.
So my other question around that is interesting as well. So a lot of people, like with our bodies, like there's different kinds of joints. So an ankle is a mobile joint, same as a wrist. Elbow is a stable joint, but only moves in one way. So in terms of pain, where do you see most of the pain happening? Is it mobile joints, or is it going to be mobile joint, or is it going to be static joints?
Actually, that's that actually happened. I haven't seen either one. It depends on the job or the type of thing they do.
Okay.
That's what I've seen. It's not that it's either mobile or it more happens in more static joints actually.
Okay.
But it depends on the person's job or what they do.
So when you say the static joint, would that be because the mobile joint above or below it isn't moving as freely as it could be? Is that?
Yes. That, and also because that's with mobility, you're allowing things to flow properly more into it, so it has more space. Whereas in a space there's more static joint staticness, you're actually creating more tightness in the area, so everything can just come. So it doesn't have to be the fact that that's more mobile. It could also be the fact that it's also just referring all that tension into that area.
Well, the reason why I ask that is we have people with frozen shoulders, right? And they'll pick up something. So whereas for me, I can lift right above my head this way, but they'll do this. Do you know what I mean? So that in itself, by having a really sore shoulder, but the compensatory movements this way could cause.
Yeah, so what I found with frozen shoulders is that it actually comes a lot from the cervicothoracic joint area. Most people, not everyone, but most people come from that area. And as we get that cervicothoracic being that neck place where the lower neck, upper back kind of join. And once we get that mobilized, then that can help free up the muscles around the area, but also simple nerve flowing better, like I said before.
Yeah. That's good. Okay. So one thing I'm really interested in, and this is like, not many people talk about it, and the people that do talk about it sometimes can be a bit woo, right? It's like an old pain. So we talked about it just before, right? So if you've got an old pain and you've injured it, and I from my experience, I've had like lots of knee surgeries, and I always babied the knee a little bit. And when I stopped babying it, it kind of got better because I was always worried about hurting it, making it worse. Whereas actually, I just needed to push through it a little bit. Do you know what I mean? Push through a little bit to get stronger. Therefore, it doesn't hurt anymore. I was just babying it because I had 8 knee surgeries. So obviously I was trying to look after it. So tell me about the old pain signals.
This is a big topic.
Yeah, I know. Okay. Do the best you can.
Let me try and pack it in. But okay, let's actually kind of talk a bit about pain itself first. When people get pain, most of the population have learned to actually stay still.
Right.
Don't do movement. Don't do anything that could aggravate it. For sure, you don't want to aggravate it. We also don't want to stay still because then when your muscles recover, they recover in a way that's going to teach it to be less flexible, less mobile, etc. So first of all, we want to make sure we're able to get I use funny words like juices flowing. Like when I say juices, I mean your lymphatic flow, your blood flow, all of that being able to flow through the muscles, through everything, through the joints, to allow healing to happen properly with the cells that come in through that, the healing cells that come in through there, the immune cells, and also to allow mobility to be practiced, exercised. Your question, yes. So with old pain, what tends to happen is typically over time, people are like, oh, this is really, really sore. I'm going to stop doing this. And it becomes, and first of all, we talked about protecting it. After protection, once you finally have had this pain for so long, you've tried so many things, and you finally found something that's going to help it. Then what happens, what I found actually, and you can tell me if I'm on track with what you asked, but what I found is once the pain's kind of gone away, we'll do assessments. That's what we do at Function Health. We do a range of assessments in the consultation, initial consultation, and then we do them again at certain checkpoints to track your progress. Once we find that the body's functioning better, they no longer have pain, they'll go a few weeks without that, and then eventually the pain begins to come back. And it's not that the pain actually came back. Sometimes it's the fact that they were so scared for it to come back, they were protecting it. As soon as they, maybe in your example, knee, you bump the knee, you've got memories both in the knee and in your brain, memory cells that are going to say, oh, that's where we used to have pain. So first of all, there's a memory factor, and you kind of like, oh, let me just guard that up again. And for some people, they be like, "Oh, that's sore," and I'll talk to them about it. It's actually still sore, and would assess it, and then realize no, it was just a memory factor. It's not actually sore anymore. They're fully able to do things. And on the other hand, some people will actually begin to get a lot of this pain discomfort again, and this has to do with some limiting factors. And this, some people, like you said, some people could think of it as woo, but I don't think it's woo at all. If you think about the science behind it, when you had the discomfort and someone asked you to go out or do some kind of cleaning that you dislike, do some chore, something you dislike doing, that pain was such a great excuse for you to not be able to do it. It was like it was your friend, it's your helping friend. It's like, you know what, I can't come out today. My knee pain is really bothering me. And now all of a sudden you can do all of this. And so when you can do all this, the pain factor is that's sometimes when the pain comes back, and it's not that the mechanically things are out of place. You can get the X-rays done, and I've had this done on multiple people. X-rays done, scans done, and it's all really good. It's the fact that you actually just don't want to be able to do those things again. And if you look into pain is actually brain, like it comes from the brain. So then if that can be a huge factor that creates pain again. In a specific area that your body's used to having pain. And on that topic, another thing is when people are really, really fatigued, really stressed, anxious, then the body is releasing a lot of stress chemicals. And that can also come into a sensitive spot or vulnerable spot where you will then feel pain, even if there isn't actually much going on there.
Sure.
But yeah.
Great. So I do know lots of people who will say that exactly that. I can't exercise because I got this pain. And sometimes they keep saying they can't do things because of the pain, and the pain is what they always think about. Therefore, they're always in pain as well. Then I got clients on the other side who do have chronic pain, by the way, as well, and are struggling, but they do it anyway. And there's one thing I like to say to our clients: you're going to be strong and in pain, or you can be weak and in pain. You got a choice, right? Because sometimes it just is what it is. You just got it, right? But you can choose how you deal with that for sure. What do you reckon?
On that, yes and no. You want to make sure you acknowledge,
of course,
the reason the pain is there. Yeah. For example, is your body saying, you've pushed me too hard, I need to... When I say push me too hard, I'm not saying, okay, let's stop moving. I'm saying, do I need to strengthen this area? Do I need to give it a bit of rest with giving some warmth, keeping it mobile, keeping it moving, maybe reducing the load on it for in the beginning and strengthening it or aligning it. And sometimes pain has nothing to do with the actual joint. Mm-hmm. That's another thing with chronic pain I've learned. We have a lot of people who come in with chronic pain, but they also have a history of anxiety or being chronically fatigued, which means have been tired for more than 6 months.
Sure.
Super tired where they sleep in the day, sleep early, throughout the whole night, nap multiple times. So that can also impact it. And then your gut health, that will also have a lot of referrals to pain. I think I went off topic there.
Okay, so the other thing, so you talk on exercise, and that's a big thing as well, right? So you're absolutely right. You should modify what you do. So like I know Alex will always say, do what pain allows, right? So you say if you've got a sore shoulder from a bursa, you shouldn't be shoulder pressing, right? But there's some stuff you can do. So in terms of what you do, would you recommend people? Would you give exercises to people? Do you give people rehab stuff, or do you not do that? Or how do you work?
First of all, when people come in, because usually people come in when they've had chronic pain. They've been to multiple people, and they could be already seeing an acupuncturist, a physiotherapist. Mm-hmm. So my goal is primarily to focus on allowing the body to reduce tension, unwind the tension, so the body's in a better space to take on the exercises they've been given by the physiotherapist. And then, like I said initially, it's about getting the nervous system to be able to flow, brain be able to communicate with the rest of the body, like, okay, this is what's happening, this is the alignment, have better alignment for the exercises. And I typically don't tell them to stop exercising unless they're in terrible pain. Then okay, let's reduce that.
Sure.
But every time people ask me, do I have to stop playing soccer or stop doing this? I'm like, no, carry on.
Yeah, so case by case.
But so typically no. But as let's say we've gone through a good course of work, and I'd see the body's opened up, and I can give them some things that help strengthen up That could be based off my knowledge from rehabilitation, a bit of it, or through yoga, but then also referring to physio to give that work as well.
Fantastic. It's good. And then I'm going to ask you one other question, because I know it's, I've seen some of your Instagram posts. People are coming for the chiro for an adjustment. Is a click and a crack an adjustment? Because people sometimes like, I want to crick so I feel better, but sometimes you don't crick them and then they don't feel better. So tell me about that quickly.
So a chiropractic adjustment is the things that we do in practice. So that's what we call it. So the treatment, you might call it in lay terms or something. But people typically see from the lovely TikTok videos cracks and stuff, and that is not the same. And so they'll come and like, oh yeah, I adjusted myself and I cracked the neck. I'm like, no, that's actually not an adjustment. An adjustment is meant to be a very specific location, specific angle, line of drive, we call it, to make sure that we're putting it into it could be the stuck joint where there isn't proper nerve flow, nerve conduction, etc. I think nerve conduction isn't the right word, but yeah, nerve flow. So we want to make sure the nerve system is flowing properly. So what I use sometimes is something called an activator as well. So it doesn't actually require a click or a crack with the hand, but could be this. And when people do this is basically similar to a hand doing it, but it's a lot more specific and a faster impulse. But when people do cracking themselves, what they're doing is just releasing, and this is a great video I always show people in my practice. There's a great video on Instagram that, could I get you to give me one first? So let's say this is the stuck joint. When you typically crack, you might actually just get the other ones that are already more mobile, which means you're actually making it more unstable in that area.
Right.
And you've got the ligaments, muscles that attach through here. Those would be the ones that you can relax. We'd be releasing gas bubbles, and that's what the noise is. So sometimes doing something with the hand, a manual adjustment, doesn't always make a noise because it doesn't always have a gas bubble in that joint. I think I covered it.
There you go. That was it. That's good. So I got no further question. I thought always think pain's a cool topic because I have lots of people with pain, and I think for me to learn as well as what I do, and then obviously to speak to you for other perspectives, I think is always fantastic. So appreciate you coming on today. Have you got anything else? Any parting words or? Yeah.
Also, talking about pain and how we talked about anxiety or fatigue, quite typically people don't realize the state of the body. So the way I work in practice is also depending on what space people are at, also considering the state of the body. Sometimes people think I'm working with emotions or something, but it's not that. It's about literally understanding, are you in an open space? Are you feeling very vulnerable? Are you feeling closed off? Very guarded up is the word I use a lot. Then you'll be tensed, right? Like if you've just been given a big fright, you tense up. Now, if you're constantly in that space, you think it's normal, you don't realize that, but that tension will also create a lot of pain. So that's just an example of how your state, how feeling anxious or feeling tired, annoyed of life or something, that can also impact a lot of pain. That's a factor people don't always consider as well.
Sure. So it's very much more of a holistic approach, isn't it, than just looking at the joint itself. You're looking at the whole sort of
picture.
Whole picture. Very
yes.
cool. Excellent. All right, good. So what I'll do as well is I'll pop your website and whatnot underneath this video podcast thing.
Yeah.
So if anybody needs an adjustment without a click, this is the place to come. And so I've been through the initial assessment as well. It's very interesting for sure. So I think people get a lot of value if they do come to you as well, which is amazing. So
thank you for having me on here.
Cool. All right, guys. See you later.